My name's Hannah Longley. I'm the Director of Community Programs with NAMI Maine. CIT is a national best practice program about responding to individuals who are experiencing a mental health crisis in the community. It originated out of Memphis, Tennessee in the 1980s following a high-profile shooting of a young man who was experiencing a mental health crisis. Memphis Police Department decided to take a deep look at themselves and look at their use of force, and what they found was a common factor in many of their use of force, particularly officer-involved shootings, was an individual who's experiencing a mental health crisis. So they partnered with the University of Tennessee, the University of Memphis, and then the NAMI Tennessee and NAMI Memphis, in order to develop a collaborative community-based program bringing together law enforcement, mental health providers, families and peers, and advocates and other community resources in order to best support individuals who are experiencing a crisis in their community. NAMI Maine was the first state to receive a platinum level certification through a very intense review process. During that, they looked at fidelity measures, which included our quarterly regional council meetings, as each part of Maine is a little bit different in their culture and their resources. So we work quarterly to bring together all of the partners to meet and to discuss any issues that are occurring. We collect data from participating police departments in order to look at critically at the mental health calls that they're responding to, and to be able to use that to implement good best practice in their specific communities and have it be appropriate for their specific communities. We have an application process for officers to attend the CIT training in which they talk about why they want to attend, why they want to be a CIT officer, how they want to best support their communities. It's then reviewed by the mental health chair, the law enforcement chair, and then a family and peer from that region. So they're selecting their own teams to be able to respond best. CIT has been found to decrease the number of individuals who are experiencing a mental health crisis, who are being incarcerated or becoming involved in the criminal justice system, by diverting them into appropriate community-based resources. What we know is roughly 20% of individuals who experience a severe and persistent mental illness will have their first interaction with any formal system with the criminal justice system. And so it helps to give officers the tools and the resources to identify someone who's experiencing a mental health challenge and to divert them from the criminal justice system whenever possible into the appropriate resources. Each CIT class is tailored to their specific region, so not only are they learning signs and symptoms about a specific challenge that someone may be facing, but then they have a concrete resource to connect with and connect that individual with in order, again, to divert from the criminal justice system. We also see that there's a decrease in injuries that are experienced by officers and by the individuals that they're responding to. We also are getting a really good, robust picture of the mental health challenges in the system in the state. So we're seeing a whole pocket of mental health calls and individuals who are struggling with their mental health that aren't touching any other formal system. And so we're able to really utilize the data that we are collecting, as well as the resources that are coming together and partnering in order to best address the needs of those specific areas.